Some of us are of the opinion that we can handle our mental health well. But then if your body says otherwise, what happens? In this episode, I will be giving you 5 signs to indicate you desperately need a mental health break. Welcome to my YouTube channel. My name is Habiba. I am a registered mental health and substance use nurse. I specialize in global mental health. And the reason for creating this platform is to promote your mental health and well-being. Thank you all for coming. So my number 1 for the sign will be inability to focus. Are you struggling to concentrate and complete a particular task that you usually in the past had no stress in completing? Do you feel you experience brain fog? Do you think you experience disorientation to time, place, and person, or even situation? That's a big one. I think it is also important to rule out the fact that there are no external factors like noise, cluttering sound, or individuals disrupting you to be able to concentrate. If all of these is ruled out and you still struggle to focus and concentrate, then you might be struggling with some mental health symptoms, which you quickly would love to address to prevent it from exacerbating. You would initially try to rule out the root cause because it could be a medical condition, it could be mood disorders, it could be the fact that you consume alcohol, it could also be the fact that you are having to take some medications. If it's not all of this, then you might need to apply the SMART goals. What is the SMART goals? This means S for specific, M for measurable, A for achievable, R for relevant, and T for time bound. You're going to be applying all of this to that task or all the tasks you do on a daily basis. This helps you to be able to reduce any ambiguous task. It helps you to be able to prevent yourself from feeling confused in carrying out those tasks. And it also helps you to be able to still end up completing the task in a timely, meaningful manner. In all of this, if you still struggle, you might need to consult a therapist or a healthcare provider. The second sign on my list is, are you oversleeping? Are you sleeping less than the required or recommended time for sleep? Okay. If you are not sleeping enough, you might be struggling with insomnia. So, what can be a factor for all of this? If you're oversleeping, it might just be a sign to indicate depression. Probably you're trying to escape from the realities of life. I mean, sleeping is an easy way out for you to face that challenge or to face your reality. However, if you are not sleeping enough and struggling with insomnia, you might be under a lot of stress. You need to pay attention to any of these. Probably you might need to help or improve your sleep patterns. I have a video on that which talks about unlocking the power of sleep. You can check one of my past videos. That's topic was well addressed. So when it's bedtime, you might try to put away devices that will distract you. You might try to unwind early enough so that you can settle for bed in time. You can also try to do some bedtime routines to help promote your sleep. My number 3 on the list will be poor personal hygiene. Are you finding it difficult to take care of your personal health? Do you feel you struggle when you're doing it? Probably you feel depressed, or probably you have some mental health disorders going on. You might try as much as you can to see a therapist to guide you or do some assessments with regards to that as well. Sometimes if we are not taking our personal hygiene serious, we might be giving room for infection. So we don't want that to happen. It needs to be addressed. Number 4 on my list is social isolation and loneliness. These two terms are threatening, life-threatening, and this indicates a call for help. Probably you stopped hanging out with families and friends, you rarely socialize, or you find so much struggle to socialize or go out there to talk and interact with people. Whatever the reasons are, it's very important to know that it is not healthy to keep going that path. So things you can do is try and talk to them. Send them text messages. Give them a call. Ask about their health. Ask about how they are doing. If you don't feel comfortable doing that, please reach out for help. Consult your healthcare providers as well. And if you feel you're in crisis, don't hesitate to call the helpline, the crisis helpline, wherever you are. And the last on my list is, do you experience feelings of anxiety and depression? Are you constantly ruminating about a stressful situation? Do you experience intense emotions, especially signs of guilt? This is one of the major and most common signs and symptoms of a mental health breakdown. And it's very important you take these seriously. It's very critical to have this kind of sign and symptom because it can exacerbate into very severe illness. So please ensure you reach out for help. Talk to a therapist or talk to your healthcare provider. And these are the signs that you need a prompt mental health break. And it is very important that we address these in a timely manner because early interventions are possibly going to inform good prognosis. We might not have control over our stressors, but certainly we do have control on how best we want to manage all of these symptoms. The need to address these symptoms in a timely manner is to prevent all of the symptoms from exacerbating into a full-blown diagnosis. So, I hope you find all of this helpful. If you feel you're struggling or you're in crisis, please don't hesitate to call your crisis line in your local area. Thank you all for watching, and please, if you like this video, don't forget to like, share, and subscribe. Thank you all for watching. It's bye for now.